Hello, everyone, and welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we're tackling an issue that affects a lot more people than you might think: a deviated septum. Whether you're dealing with sinus issues, trouble breathing, or even mental health challenges, this condition can have a huge impact on your day-to-day life.
And you're absolutely right, Emma. Deviated septum is surprisingly common. Up to 80% of the population might have some degree of septal deviation, though many people are asymptomatic. But for those who do have symptoms, it can seriously affect their quality of life, causing problems like nasal obstruction, chronic sinus infections, and sleep disturbances.
And that's just the physical side of things. What's really eye-opening is the connection between chronic sinonasal conditions, like a deviated septum or chronic rhinosinusitis, and mental health. Recent research shows a clear link between these conditions and increased rates of anxiety and depression.
Exactly. One study measured anxiety and depression using the Hospital Anxiety and Depression Scale, HATS, and found that the severity of nasal symptoms was closely linked to higher anxiety and depression scores. It's crucial for healthcare providers to treat not just the physical symptoms, but also the psychological burden of a deviated septum.
And this is especially true for younger patients who seem to experience more distress than older individuals. In fact, studies show that mental health issues are often more pronounced in younger patients with chronic nasal problems, which means targeted interventions are necessary.
That's a really important point. Addressing the mental health component can lead to better outcomes overall. But when it comes to physically treating a deviated septum, one of the most common solutions is septoplasty, a surgical procedure to straighten the nasal septum and improve airflow.
And while septoplasty can be very effective, there's some debate in the medical community about postoperative care, specifically the use of nasal packing. Some otolaryngologists believe nasal packing helps prevent complications like bleeding or hematoma formation, while others argue it causes unnecessary discomfort for patients.
Yes, and there's a growing trend toward using alternatives like quilting sutures instead of traditional nasal packing. According to a recent survey, about 66% of surgeons believe that quilting sutures can effectively replace nasal packing, which could make recovery a lot more comfortable for patients.
And speaking of comfort, not every patient with a deviated septum opts for surgery. Some choose non-surgical treatment, like nasal steroids or decongestants, to manage their symptoms. But when comparing surgical and non-surgical approaches, research shows that septoplasty generally offers more significant long-term relief, especially when it comes to improving scores on the Nasal Obstruction Symptom Evaluation, NOS, scale.
Absolutely, but surgery isn't without risks. Complications like bleeding, infection, and even the need for revision surgery can happen. That's why some patients opt for non-surgical aids, like nasal dilators, which can help improve airflow, especially for people with obstructive sleep apnea.
Yes, nasal dilators like Breathe Right strips or internal devices like Nosovent can provide relief for some patients, but their overall impact on conditions like sleep apnea is limited. A systematic review showed that while internal nasal dilators can slightly reduce the apnea index, the overall improvements in sleep apnea symptoms aren't statistically significant.
So, while nasal dilators can help some people breathe easier, they're best used as supplementary treatments, particularly in conjunction with CPAP therapy for sleep apnea. But there's another area that's really interesting: dietary changes. There's emerging evidence that certain diets can help reduce inflammation and improve respiratory symptoms for people with chronic sinus issues.
That's right. Low histamine and low salicylate diets have been shown to reduce inflammation and alleviate symptoms associated with chronic rhinosinusitis and a deviated septum. It's a great example of how managing symptoms can involve more than just medications or surgery. Diet can play a crucial role too.
And that brings us to one of our favorite topics: herbal remedies. We have an herbal formula designed specifically to support people dealing with a deviated septum. This formula addresses both the physical inflammation in the nasal passages and the emotional distress that often accompanies chronic sinus conditions.
Exactly. Let's break down the ingredients. First, we have turmeric, one of the most powerful natural anti-inflammatory agents. Turmeric contains curcumin, which not only helps reduce inflammation in the nasal passages, but also supports overall immune function.
Yes, and next up is bromelain, an enzyme found in pineapple. Bromelain has been shown to reduce mucosal inflammation and nasal congestion, making it easier to breathe. It also enhances the absorption of other compounds like curcumin, so it works synergistically with turmeric.
Then we have magnolia, which is particularly interesting because it tackles both the physical and emotional symptoms. Magnolia contains compounds like magnolol and hinokiol, which have anti-inflammatory and anxiolytic anti-anxiety properties. This can be really beneficial for patients dealing with the anxiety and stress caused by chronic nasal obstruction.
That's a great point. And for the mental health aspect, we've included St. John's wort, which is well known for its antidepressant properties. It's been used for centuries to alleviate symptoms of anxiety and depression, which makes it a natural fit for people whose mental health is affected by their physical condition. But as always, caution is advised because St. John's wort can interact with other medications.
Exactly. We've also included ginger, which is another anti-inflammatory powerhouse. Ginger can help soothe irritated nasal passages and support immune health. It's great for reducing inflammation and promoting overall respiratory health.
And let's not forget butterbur, which has been shown to reduce symptoms of allergic rhinitis. This can be particularly helpful for patients whose nasal symptoms are worsened by allergies. Butterbur helps to open up the nasal passages and improve airflow.
Finally, we have spirulina, a microalgae that's rich in antioxidants. Spirulina has been shown to reduce symptoms of allergic rhinitis and improve nasal airflow, which can be a game changer for people with a deviated septum. It also helps boost the immune system, providing overall support.
So with this blend of herbs, we're addressing not just the physical symptoms of nasal obstruction, but also the emotional and psychological challenges that come with chronic sinus issues. Of course, it's important to consult with a healthcare provider before starting any new herbal regimen, especially if you're on other medications.
Absolutely. The dosage and quality of the herbs are also key. Always look for high-quality, standardized extracts to ensure consistency and effectiveness. Start with a low dose and gradually increase to assess tolerance and effectiveness.
And monitoring progress is crucial. Regular follow-ups with a healthcare provider can help adjust the herbal formula as needed. You'll want to track improvements in both nasal obstruction symptoms and mental health, using standardized scales like the nose scale for breathing and HATS for mental well-being.
The management of a deviated septum isn't just about physical correction. It's a holistic approach that includes addressing mental health, exploring surgical and non-surgical options, and even looking at dietary and herbal interventions. By recognizing the interplay between all these factors, healthcare providers can offer more comprehensive care and improve the overall quality of life for those dealing with this condition.
Exactly. Whether it's through surgery, herbal remedies, or lifestyle changes, the goal is to find a personalized treatment plan that works for each individual. If you want to learn more, check out the full article on our website.
Thanks for joining us today on the Lost Book of Herbal Remedies. We hope you found this deep dive into deviated septum treatments helpful. Remember, health is about the whole picture. Physical, mental, and emotional well-being all play a role.
Stay curious, stay healthy, and we'll see you next time with more insights into herbal remedies and holistic health solutions.
Take care, everyone.